Each year the Donaghue Foundation provides this annual meeting, and it really has two purposes. One is to allow the foundation to give a bit more of a public accounting of the things it's done in the past year, some of the grants it's made, and some of the important themes that we're working on in our grant programs. The other purpose is to allow an opportunity for some really interesting, thought-provoking speakers to come and speak to the broader audience of people who are interested in medical and health research.
So what the Donaghue Foundation, I think, does that's really interesting to me as an outsider getting to observe it is it's trying to seed the innovations that change how our systems work. And it has led to some very practical results that interested me as much today in coming to learn about as getting to talk about that perspective. Hand washing is a emblematic example of a general problem we face in medicine. So here we have 2 million people across the country who pick up infections in our hospitals on an annual basis. 90,000 of them die from those infections. And we've known for 130 years that if we just wash our hands, we could prevent these kinds of infections from happening. In a way, what we haven't realized is that we are more likely to save lives in the next decade, more likely to save more lives in the next decade from the work that you all are doing in this room to understand how to close the gap between what we know and what we do, than from discovering new things. I would venture that in the next decade we will save more lives trying to understand how to perform with the knowledge that we have than we will from stem cell therapy or research on cancer vaccines or almost the entirety of the basic science effort that we're engaged in.
Many of the innovators have been gracious enough to allow sharing of their innovations despite the fact that they have patents and copyrights. All that we are requesting is that they are willing to provide enough information about their innovations so that the public can know what it is, the answer to what question of what's the innovation. They do not have to hand it over for free.
But I do think if Donaghue money goes in or if NIH money goes in, there is some certain expectation that the public owns at least some of that. And how that figures in, I think, is important. With regard to the universities, I know they're very interested in being able to use these things as revenue streams. Again, I think it depends where the money comes from. If the university has made the investment and that's where the discovery comes from, I feel very differently about it than if it came from my tax dollars and those contributed to that discovery and innovation. And I think we really have to sort this out. I think it is in some cases a tremendous threat to adoption. I worry about it with regard to disparities. If all the best innovations become high-priced and only accessible to certain places, and it can contribute to those differences in places that can afford it. And I think it is an important area that we need to consider.
For those of us who do have more of a research bent, just giving people the factual information isn't enough. You have to provide it to them in a way that they can make an emotional connection to it. And I think that's probably the biggest take-home message. Not that we're doing it perfectly. I think we're doing it better than we were before, but we ourselves have a ways to go. So that to me, is the main take-home message I would give.
I think there are lessons around for all of us. And I think if we did one thing right on Door to Bloom, which we didn't do as well on our first iteration, which was around beta blockers, was begin to understand that it wasn't about just telling people the facts. Do you know that this improves survival? Why aren't you doing this? You know, that didn't do it. That wouldn't have worked in this case.
And I think there's a skills aspect to a lot of the organizational change innovation processes that we're not that clear on yet, what the skills are. And these are multi-level, very complex social systems that we're trying to change.
For the last 3 years, we've held a conference called Beyond Eureka. And really the purpose is to make the point that research that we fund is only going to be really valuable if it gets used by consumers, by policymakers, by practitioners, by the healthcare system. And in order for that to happen, you have to bring together all these sectors so that they understand what it takes to move research into use.